Itchy throat and cough with phlegm. Causes, symptoms, and effective prevention. Itchy throat with cough with phlegm is a common condition, originating from many different causes, including diseases or environmental factors. This is not an independent disease, but a symptom reflecting underlying problems in the body. This condition can affect all ages and, if not treated promptly, can cause discomfort, seriously affecting the quality of life and overall health. Common symptoms. Itchy throat and cough with phlegm are two symptoms that can appear separately or at the same time, depending on the cause and health condition. To clearly identify, you need to understand the characteristics of each symptom. Itchy throat. A feeling of discomfort, tingling, or irritation in the throat area, often stimulating the cough reflex to relieve. Cough with phlegm. Mucus, phlegm, secreted by the sinuses or nose accumulates in the throat, causing a feeling of obstruction and discomfort, leading to coughing. Phlegm can move down to the lungs if not treated, increasing the risk of complications. Depending on the cause, the patient may experience accompanying symptoms such as, due to allergies, sneezing, runny nose, itchy ears, watery eyes. Due to infection, high fever, body aches, exhaustion, swollen lymph nodes. Due to other diseases, hoarseness, difficulty breathing, difficulty swallowing, chest tightness. The severity of symptoms depends on the specific condition and cause. Early recognition of these signs is important for timely treatment. Mechanism of itchy throat and cough with phlegm. Itchy throat and cough with phlegm are natural reflexes of the body to protect the respiratory tract from irritants. This mechanism involves the nervous and immune systems. Sensory nerves in the airways, such as the pharyngeal and vagus nerves, are stimulated by allergens, bacteria, or environmental factors. They send signals to the brain, triggering itching sensations and a cough reflex. The immune system responds by releasing inflammatory mediators such as histamine and leukotrienes. Histamine causes itching and inflammation in the throat. Leukotrienes stimulate airway constriction, increase mucus production, phlegm, leading to coughing. Coughing is a mechanism to expel mucus or irritants from the body, helping to clear the respiratory tract. Causes of itchy throat and coughing up phlegm. Sinusitis. Sinusitis occurs when the sinus cavities, behind the forehead, cheekbones, become inflamed due to bacteria, viruses, or fungi. This condition increases mucus production, causing congestion and leading to symptoms such as facial pain, stuffy nose, and discharge. Excess mucus flows down the throat, causing itching and coughing up phlegm. Sorting pharyngitis. Sorting is often caused by infections from viruses, bacteria, or environmental factors. Symptoms include sore throat, itching, dry cough, or cough with phlegm, fever. Depending on the type of pharyngitis, acute, chronic, or granular pharyngitis, the severity of symptoms may vary. Bronchitis. Bronchitis, acute or chronic, is an inflammation of the bronchial tubes in the lungs, causing increased mucus production. Patients may experience symptoms such as coughing up phlegm, itchy throat, wheezing, chest tightness, and fatigue. If left untreated, bronchitis can progress to pneumonia. Pneumonia is a serious condition that affects the alveoli and structures in the lungs. The buildup of pus or fluid causes a cough with phlegm, fever, chills, and difficulty breathing. Pneumonia can be caused by bacteria, viruses, fungi, or chemicals, and needs to be diagnosed early to avoid complications such as respiratory failure and sepsis. Gastroesophageal reflux. Gastroesophageal reflux occurs when the lower esophageal sphincter weakens, allowing stomach acid to flow back into the esophagus and throat. The acid irritates nerves, causing a sore throat and cough, dry, or with phlegm. This is a common but often overlooked cause. Asthma. Asthma is a chronic condition characterized by inflammation and spasm of the bronchi. The disease increases mucus production, causing airway obstruction, leading to a cough with phlegm, sore throat, difficulty breathing, and wheezing. Symptoms often recur when exposed to irritants such as dust, pollen, non-pathological causes. In addition to diseases, some environmental and lifestyle factors can also cause itchy throat and cough with phlegm. Smoking, drinking alcohol, or using stimulants. Environmental pollution, dust, chemicals, moldy air. Sudden changes in weather. Unscientific diet, drinking little water. Dehydration due to hot weather or strenuous activity. When to see a doctor. A persistent or severe itchy throat and cough with phlegm can be a sign of an underlying disease. You should see a doctor immediately if symptoms last for more than 2 weeks, increasing in frequency and severity. There are serious signs such as high fever, difficulty breathing, chest tightness, wheezing, blood in the sputum, or severe chest pain. Effective treatment. Treatment depends on the cause and the patient's health condition. Common treatment directions include medication, antibiotics, anti-inflammatory drugs, treat bacterial infections, pain relievers, antipyretics, relieve accompanying symptoms, nasal, throat sprays, reduce irritation and thin phlegm, eyes, medical intervention. In some cases, such as chronic tonsillitis, the doctor may recommend surgery. Treatment compliance. Patients need to take the correct dose of medication and return for follow-up visits as scheduled to ensure effectiveness. Home support measures. In addition to medical treatment, you can apply home remedies to reduce symptoms. 1. Drink enough warm water. Helps thin phlegm, soothe the throat. 2. Gargle with saline. Antibacterial, reduces inflammation and removes mucus. 3. Steam the nose and throat. Thin mucus, improve breathing. Perform under medical guidance. 4. Use honey. Mix warm water with honey or combine ginger, cinnamon to fight inflammation. Reduce cough. 5. Add ginger. Use ginger tea or dishes containing ginger to increase antibacterial ability. 6. Use lemon. Combine lemon with honey to sterilize. Reduce inflammation. Use in moderation. 7. Lemon basil leaves. Boil water to drink to increase resistance, reduce itchy throat and cough. How to prevent itchy throat and cough with phlegm. To reduce the risk of this condition, you should keep your body warm in cold weather. Avoid drinking cold water or eating too cold food. Keep your house and personal belongings clean. Wear a mask in crowded places or polluted areas. Wash your hands regularly with soap or antiseptic solution. Build a scientific diet rich in vitamin C, omega-3 to strengthen immunity. Have regular health checkups twice a year to detect respiratory problems early. Thank you for watching the video. Wish you and your family good health and happiness.